Welcome to the district. I'm your Fulton County Commissioner of District 4, Natalie Hall. The district is the place to keep you updated, informed, and inspired regarding everything Fulton County District 4. Immediately following this short break, we will hear from board-certified interventional radiologist and renowned authority in the non-surgical treatment of uterine fibroids, Dr. John Lipman. Don't go anywhere. We will be right back. Welcome back to the district. I'm your Fulton County Commissioner of District 4, Natalie Hall. Joining us today is Dr. John Lipman. It's an honor to have a board-certified interventional radiologist with us today. Dr. John Lipman is a renowned authority in the non-surgical treatment of uterine fibroids. Dr. Lipman has a very distinguished educational background. He has received his master's and medical degrees from Georgetown University School of Medicine in 1985. He completed a residency in diagnostic radiology at Brigham and Women's Hospital, Harvard Medical School, and then a fellowship in vascular and interventional radiology at Yale New Haven Hospital and Yale School of Medicine. Dr. Lipman was awarded the highly acclaimed fellowship status in both American College of Radiology and Society of Interventional Radiology with over 200 invited lectures delivered and countless awards. He's a trailblazer physician and top doc. How are you, Dr. Lipman?
I'm great. Thanks for having me. It's a pleasure.
Thank you for being here to discuss such a serious topic that impacts so many women's lives. So tell us, what exactly are uterine fibroids?
Well, uterine fibroids are benign tumors. It's the most common pelvic tumor seen in women. So while it's not a cancerous tumor, it's benign, it can cause a lot of misery, and it's seen in many women. Say it's the most common tumor of the pelvis in women, and it's particularly prevalent in African-American women. 80% of adult African-American women have these tumors.
Well, where do these fibroids come from?
Well, I wish we could tell you. There hasn't been, unfortunately, a lot of research in this area on where fibroids come from. So nobody knows exactly where they come from, but once they arrive, they grow with estrogen. And that's why they can grow rapidly during a woman's pregnancy, and why they tend, for the most part, not to be an issue when a woman goes into menopause.
Well, is it true that fibroids are more common in African-American women?
Absolutely, yes. As I say, up to 80% of adult African-American women have these tumors. And there are a number of reasons why. Some of it is genetic and you can't really do anything about, but as I mentioned earlier, they grow with estrogen, and estrogen is produced and stored in body fat. And in general, African-American women have more body fat than other racial groups. And so we try to talk to them about eating well, limiting kind of estrogenic foods like red meat, non-organic chicken, and dairy, and try to increase colored fruits and vegetables, which have flavonoids in them, which block an important enzyme in estrogen production. It also has to do with vitamin D. Vitamin D is a very powerful anti-fibroid growth hormone. It's really a hormone, not a vitamin. And if you have a normal vitamin D, you have a much lower chance of having fibroids. Unfortunately, only 10% of African-American men or women have a normal vitamin D. And so they're not getting the right amount because of the difficulty in absorption through the skin. The darker the pigment that you have, the harder it is to absorb adequate vitamin D. So we always have the patients check their vitamin D level, supplement it as necessary. So there are things that women can do to try to improve their fibroid risk, but some of it is genetic.
Well, what are the most common symptoms seen in women suffering with fibroids?
Well, we call them the big three. First off, heavy menstrual bleeding. It's the most common reason why women have heavy periods each month. And sometimes women aren't aware what exactly is heavy, but if you're changing frequently, more frequently than every 3 or 4 hours, or you need more than one pad at a time, or you get episodes of blood kind of gushing out or flooding or clots, those are all abnormally heavy periods, no matter how long you've been doing it. And we'll have patients tell us, well, I thought that was normal because I've been doing it for a long time. It's not normal. So heavy bleeding, number one. Pelvic pain, number two. These tumors are hard and firm. They're like rocks, and they press on things, and women can sometimes feel them. And so they'll press on pelvic nerves to cause pain. They may radiate into the low back, the buttock, the hips, down the legs, sciatica. And that can mislead the physician who thinks maybe she's got a lower back strain when actually it's fibroids. So that's number two. And then the third is increased urinary frequency. When these fibroids are in the front of the uterus, the bladder sits right in front, and these rock-like fibroids act like paperweights to compress the bladder. So a woman, her bladder can't fill appropriately, so she has to go more commonly. And oftentimes it wakes her up multiple times in the middle of the night, just like her husband who has the prostate condition.
Well, Dr. Lipman, thank you for this discussion. Let's take a quick break, and when we return, we will continue our discussion with Dr. Lipman. You don't want to miss it. Welcome back to the district. I'm your Fulton County Commissioner of District 4, Natalie Hall. If you're just joining us, we have the honor of having Dr. John Lipman on the district. We've been discussing uterine fibroid embolization with Dr. John Lipman, a renowned radiologist. Dr. Lipman, thank you again for joining us.
Oh, my pleasure. Thanks for having me.
Dr. Lipman, tell us, what are the options for treating fibroids?
Well, for women that have fibroids, there are a number of women that don't have any symptoms at all. And so they don't need any treatment. But as we discussed, some women get very significant symptoms, whether it's heavy bleeding, pelvic pain, or urinary frequency. And typically that will send them to their gynecologist. The gynecologist will perform a history and physical exam to determine the severity of their symptoms. Also, they'll do imaging to confirm what they might feel on a physical exam. You can feel these fibroids. They're like rocks. They're hard and firm. And so usually they will confirm the diagnosis with an ultrasound in their office. And then the treatment options become oftentimes a birth control pill or some form of hormonal therapy, maybe a hormonal IUD, that will tend to lighten flow. But unfortunately, since they have hormones in them, as I mentioned earlier, that can stimulate fibroid growth. So they might be placed on a non-steroidal anti-inflammatory like ibuprofen for pain. But these medical therapies, unfortunately, aren't very good. And so, unfortunately, they go from little or no treatment to being recommended surgery by their gynecologist, often forgetting that there is an outstanding non-surgical procedure called UFE, uterine fibroid embolization. It's performed by interventional radiologists, not gynecologists. So you would need a referral for a second opinion, but almost everybody that is a candidate for surgery is a candidate for UFE, and it has numerous advantages over surgery. It's completely non-surgical. It's outpatient. Patients come into our center, they have a 30-minute procedure, they recover for a few hours, and they leave with a Band-Aid. So no hospital, no general anesthesia, no surgical wound or incision, and they get to keep their parts, because unfortunately, most women are often told that hysterectomy is their only option. And the most important thing I'll say today is that no matter what your gynecologist tells you, if you're suffering with fibroids and are only hearing about hysterectomy, you do not need hysterectomy no matter what they say if it's for fibroids. And everyone should at least look at UFE because it's one of the biggest breakthroughs for women, and it's been around for a long time, 25 years. So it's well proven, safe, and effective, and it treats all the fibroids, no matter if you have 1 or 100, doesn't matter how big they are. The procedure is covered by insurance. It's a truly remarkable procedure. The biggest problem is most women are unaware of it.
Well, Dr. Lipman, can you explain how uterine fibroid embolization actually works?
Sure. What we want to do is we get access. We at the top of the right leg where you feel your pulse, we enter and we can guide a little tiny catheter like a piece of spaghetti into each uterine artery one at a time. And each of the uterine arteries branch like a tree, getting smaller and smaller branches to get out to the leaves. The fibroids are the leaves of the tree, and I can plug the blood supply up of those fibroids. The big trunk and the main branches stay open, so the uterus stays alive, and we've had numerous children born after UFE. I've had multiple sets of twins. But the fibroids should all die without a blood supply. So as these fibroids die, these hard rock-like benign tumors start to soften and shrink. And as the softening and shrinking of all the fibroids occurs, the woman's symptoms go away.
Well, uterine fibroid embolization sounds safer, easier, and less time away than surgery. Why aren't more women opting for uterine fibroid embolization?
Well, I think they would if they knew about it. That's the biggest problem. There are over 600,000 hysterectomies done in the United States every year. And the most common reason why are fibroids. And so the question becomes, why are we doing so much surgery for benign disease? I mean, this condition affects African-American women disproportionately, and the average age is less than 40. And I've met way too many women less than 30 have already had hysterectomy for fibroids. None of them wanted it, but they aren't being told about it from their gynecologist. So it's really imperative that women know about UFE and to see if there are a candidate. Almost everybody that's a candidate for surgery is a candidate for UFE. So I would recommend a second opinion from an interventional radiologist like myself that does this UFE procedure, because it truly is one of the biggest medical breakthroughs for women, particularly women of color, who disproportionately suffer with these benign fibroids.
Don't hysterectomies have significant side effects?
They really do. And so, while gynecologists may mention the surgical side effects, bleeding during surgery, infection, wound issues, they often won't mention, well, what happens to a woman when she loses her uterus? And remember, these are typically young women. So there's psychological issues in a number of women. Women might feel like a man being castrated, losing their womb, their essence, what makes them a woman. There's a lot of sexual dysfunction after hysterectomy, loss of libido, loss of orgasm, urinary leaking, a lot of urinary leaking. In fact, if you go to where they sell adult diapers, you won't see an elderly man or woman on the packaging. You'll see a young African-American woman on the package. And so that should give us pause, because they know who their target audience is, young 30s to 40-year-old African-American women. I mean, why are we essentially amputating young Black women for benign disease? It just shouldn't happen. There's a lot of bone loss after hysterectomy, and now there's even evidence to suggest it increases your cardiovascular risk. The bottom line is you don't need it. So no matter what your gynecologist says, you do not need hysterectomy for benign fibroids.
Dr. Littman, oftentimes insurance is an issue. Does insurance cover uterine fibroid embolization?
It absolutely does. So all insurance is covered, including Medicare and Medicaid. Now, there are women, obviously, that don't have any insurance, and that can be a challenge, but every insurance company covers UFE.
I think I heard you say earlier that women have gone on to have many children after uterine fibroid embolization. And so does this procedure make it easier for them to have children?
Well, in a sense, yes, because oftentimes the fibroids are the culprit. And so we've seen numerous women who haven't been able to get pregnant because of these fibroids, have a UFE procedure, and then get pregnant. So I would say absolutely yes, it improves the chances of a woman having children, because oftentimes the fibroids are the culprit. The births that we've seen typically after UFE are full term and vaginal births versus the surgical alternative, which is called a myomectomy, surgically cuts a woman open, cuts open her uterus, and tries to take some of the fibroids out. It does risk hysterectomy, and that can be a problem. It also, you can't surgically oftentimes remove all of the fibroids. So a woman might undergo a surgical myomectomy and then recur with all the symptoms within a few years because the ones they didn't get out grow and she's right back to square one. So that's an issue with myomectomy. And also the births after myomectomy, once you surgically cut on the uterus, they're not going to let you have a vaginal birth. You're going to have more surgery, a C-section. In fact, hysterectomy is the number 2 surgery we do in the United States. C-section is the number 1. So the bottom line is you don't need any surgery. You could avoid surgery altogether. You could get the relief of symptoms you're looking for with UFE. You avoid the risks and long recovery. For an open hysterectomy, the recovery is about 2 months away from work versus UFE, the recovery is 5 or 6 days, and it's dramatically shorter, obviously. So you get the relief of symptoms, you avoid the risks and long recovery of surgery, and importantly, you get to keep your uterus, not lose it. So UFE has a lot of advantages, and I just wish more women would know about it.
Dr. Lipman, you're an angel. Can women get to see you directly, or do they have to be referred by their physician? And if so, how do they reach you?
Well, they can reach me directly if their insurance product is a PPO or POS plan. If they're an HMO plan, then they would need a referral from a gynecologist or a primary care physician, but that's really easily done. The way to reach me, number of ways. Our website is atlii.com, atlii.com, and you can make an appointment through there. You can see all the information about fibroids and the UFE procedure. I have an Instagram page. Some people like Instagram. That's dr_ my last name. So it's dr_Lipman. We have a YouTube channel with over 150 videos on UFE and on fibroids. That's Atlanta Fibroid Center. And then the old-fashioned ways to pick up the phone and call my office, 770-953-2600, 770-953-2600.
Dr. Lipman, thank you for taking the time to share the importance of what you do to eliminate fibroid tumors and save so many women's lives. We appreciate you. I'm going to call you the UFE angel.
That's very kind of you. I really appreciate the opportunity to talk about it today because, as I say, the biggest problem is awareness, and I hope that this will generate more discussion. Women will talk amongst themselves. They'll talk with their partners, their husbands, sisters, daughters. We just need to increase the conversation because, unfortunately, women's periods have been kind of a taboo subject. There's can be shame associated with it. People can feel like they're alone. They're not alone. This is an extremely common condition. As I say, fibroids are the number 1 reason. And we just need to increase the discussion and conversation.
Yes. Well, Dr. Lipman, thank you. And when we return, I will share my closing thoughts. Welcome back to the district. I'm your Fulton County Commissioner of District 4, Natalie Hall. If you're just joining us, we had the honor of hearing from Dr. John Lipman, a board-certified interventional radiologist and renowned authority in the non-surgical treatment of uterine fibroids. It was a pleasure talking with Dr. Lipman on the district today. Dr. Lipman saves lives with the non-surgical treatment of uterine fibroids. We discussed Dr. Lipman's interventional radiology method, which is his preferred plan for removal of uterine fibroids. He gave us information on how to get a better quality of life by having a non-surgical procedure. Fibroids are the most common non-cancerous mass that occur in female reproductive organs, and we learned that women can be referred by a physician or contact Dr. Lipman directly and the procedure is covered by insurance. This procedure saves women's lives. And as Dr. Lipman would say, don't lose your you.